Deal with what are you going to deal with?
Well, the conspiracy theory.
Okay.
For a minute, because I mean, certainly my experience of working in this area is that there's plenty of talk about conspiracies, but not really an awful lot of evidence around it. The fact is that our system and the principles still remain largely true. They were undermined a bit by dentistry charges and prescription charges, but free at the point of delivery survives, and it's gone through the test of time. There are issues around social care where people have to pay and have had to pay since 1948, and that line between what is social care and health care remains a very significant challenge. But I think that if we're trying to look forward, what we do need to do is try and persuade this government or any future government that the health service and the care system needs adequate funding, and it is not getting adequate funding at the moment. That's the central issue, not some conspiracy theory that there are a bunch of dark forces at work to try and privatise the NHS.
Well, you don't think that's the case, because you hear that an awful lot, don't you? This is the secret agenda. This is what they're trying to do.
Ironically, this administration, which you might think would like the independent sector, is actually shunning it and is saying no, and indeed the ideas, some of the market ideas which were brought in 2012 are actually being undermined and challenged by the current attempts to reform within the current legislation to try and bring things together and make them more integrated. So the direction of travel doesn't look like the way in which the conspiracy theorists are putting it. And of course, politicians write things years before. That doesn't mean that they're actively doing that now. I think if you were to ask...
30 years ago.
And it might be worth asking Bob Kersley this question, because he was head of the civil service at the time.
You ask him the question.
All right, well, I'll ask you the question then, Bob. Did you find that when you were head of the civil service, that the health minister was coming to you saying, actually, what I really want to do here is privatise the NHS?
That wasn't part of the plan. Of course, it was a coalition government, Neil, so you had Liberal Democrats and Conservatives in government, and clearly, even if they'd wanted to, it wouldn't have been part of the agenda for that government. What I think the real risk is, if we don't sort the funding problem out, the desperate need to do something might push people in the direction of saying, well, everything else has failed, let's just try putting more of this in the private sector.
Okay, and I can't wait to actually come to the funding bit, because it's so fascinating. But just on this bit, before we do address that, we've got other things. Just one second. I want to come to you in a second, and Alex as well. But on this funding issue, and you mentioned governments actually coordinating with future governments to try and work out what they're going to do beyond the horizon. That just does not happen, does it? Thinking beyond the electoral cycle. How do we make sure...
That's what we have to achieve this time round.
How can we achieve that?
We must achieve that.
But politicians, that's not what politicians do.
Well, politicians have got to have their feet held to the fire. And throwing out an extra $1 billion here or $2 billion there, playing smoke and mirrors, that doesn't work. The reality is that what we're going to face over the next 10 to 15 years is a doubling of the number of people over 85. We are going to see increasing problems of people with long-term conditions. We will see increasing demand being made of the system, which will put increasing pressure on hospital services and on community services. So unless we, one, get the funding right, and I think there are ways of providing some objective evidence which politicians will find it very difficult to reject, and secondly, sort out how we organise it in the different parts of the UK, because as Nina rightly says, they're now talking about 4 slightly different systems. A lot of people who talk about things are actually referring to the English health service, not to what's happening in Scotland.
What should we do with GPs then, Alex?